Welcome to Vitamin B with Mohana. This is where we help you take control of your well-being. My guest today is Dr. Nalini Saligram, an Ashoka Fellow, a global health advocate, and the founder of Arogya World. Nalini holds expertise in the prevention of non-communicable diseases, and she is joining me today to talk about one of the most important problems in the health space, which is diabetes. Diabetes surrounds the world with millions of people being affected by it. And did you know that in India alone, we rank the first in the world in terms of the number of cases that the country holds? With 77 million diabetic patients within India, what do we understand about the disease, about its causes, about its prevention and mitigation?
India is now clearly number one in the world. India is going down. Demographic dividend is going to become a demographic disaster. Indians are getting diabetes at the height of their productive years. They have decades to live with their disease. 100 million diabetics in India, 136 million pre-diabetics.
That's the sort of downside of development, right?
Indians eat 5 times more salt than is prescribed. We eat carb with carb.
Yeah,
we eat
true.
puri with aloo. Young mother who is undernourished is probably going to set up that baby to get diabetes. Waist circumference in Indians is a predictor of diabetes. 10% of India's 5-year-olds, 5 to 19-year-olds are pre-diabetic.
Wow.
Quitting tobacco is probably the single best health decision you can make in your life.
But are there other symptoms other than getting a test to know that I am diabetic?
There is a rapid weight loss and increase in thirst. With 3 lifestyle changes, you must eat right, exercise, and avoid tobacco. These 3 changes, according to the World Health Organization, fruits that are very high in sugar, for example, chiku, grapes, bananas, very high. Follow my thali. We like to keep people healthy, people healthy.
So come join us in this highly knowledgeable and informative session with Dr. Nalini, and sit back, relax, and I'll see you at Vitamin B. Hi Vitamin B community. We have always been very bullish about your health and your well-being. And I'm super happy today to be launching the very first merchandise which I know will make a difference to each one of us, which is the Vitamin B Granola. This granola has been in the making for over 2 years now, with our core team having it on a daily basis. So we felt it was important to spread the awareness and ensure each one of you has the opportunity to taste it and improve your health. Get your first pack, order now, and we are available in Namma Bengaluru, where we have a number of customers who have already promised us and validated that this product is truly nutritious. So check out the comments box where you have an opportunity to place your order in the link provided, or reach us on Instagram DM to get your first bag of Vitamin B Granola. I'll see you soon. Stay tuned, be healthy, and be confident. Nalini, welcome to Vitamin B with Mohana. It's a pleasure to have you here.
It is really delightful, Mona. Thank you for inviting me. I'm looking forward to the conversation.
Yeah, I'm totally looking forward to it. It's a very important topic that we're going to be spending time on. But before that, you're here in India, and you have is it the 10th year or the 9th year of Arogya World?
No, it's the 14th.
14th year. That's amazing. So congratulations.
Thank you.
And I think this year again you have something very interesting.
Yeah.
But I think thank you for bringing consciousness to organizations through your initiative. You're founding Arogya World. That's really making companies, whether there was COVID or not, health becomes so important in a workforce. And I think it's raising consciousness more and more. So it's a great annual thing that you all are actually doing. It's wonderful.
Thank you.
Great. So Nalini, I think you have spent almost all your professional life in the space of prevention of non-communicable diseases, right? So what got you inspired to be more connected to this space?
Yeah, so my life took me from Bangalore, where I did my Indian Institute of Science and Central College education,
Yeah.
to all over the world, actually, different paths, following my husband and family around. 14 years ago, in 2010, I decided to quit Merck, where I was working, to do this full time. And I decided to start a nonprofit, Arogya World, and work pro bono. And it's the best decision I made in my life, because every single day I can't wait to get out of bed and start the day, because there's so much going on.
Yeah.
And I know I am making a difference. See, that was the most important thing, that I could feel that I could contribute really meaningfully to global health. So that was what got me started. I wanted very much to use all of me, my science background, my ability to talk to people at various levels, my global experience, and really put it to some good use. And we chose diabetes and its prevention because I knew the power of prevention in a space like diabetes, in a disease like diabetes, and that the persuasion, the behavior change, the individual as well as societal level work really used a lot of the things that I could bring to the table. And I realized that this was a big need. There were landmark clinical trials, but to bring that to the grassroots, to make consumers understand it, to make communities appreciate it, was this translation work that I felt I could do.
And primarily the work is in India, right?
Primarily the work is in India. Diabetes runs in my family, and I had seen firsthand everything it did, from, the decades of medicines and treatment, plus the complications and the dialysis. I mean, it's the whole gamut. So I wanted very much to contribute to a field of global health where I could make a difference. And women's health and under 5 childhood mortality and HIV were all wonderful spaces in public health, and everybody those phases were over. I wanted to get into a space that was starting, and diabetes is one we chose. And just after I started Arogya World, a few months later, there was the WHO announced the UN heads of state meeting the following year. So I said, this is why I have to quit my job and do this, because now I can have a front row seat. And it has been, as I said, very inspiring to work with people and like-minded organizations and do the best, because no one can do it alone.
No, absolutely. And I've worked with your team. They're always so spirited and positive and very engaged. Right? I think something to do with helping others. Transforms you as a person. Only when you do it, you realize it in time, I suppose. And then when it's connected to your passion, the field that you want to, you'll generate that energy, right? So it's all
I'm always in awe of the people who join us. First of all, those who join nonprofits, but those who join us, for example, whether they are board members or junior staff, everyone is doing it with passion, so, and that makes the difference in the output as well.
Absolutely. And while a lot of the work is through corporates, right? And then you have other things that you do also, right? Tell us about that.
Yeah. So, our purpose is to prevent diabetes through healthy living. We want to help people change behavior with intent. And we want to do that outside the doctor's office. Because the doctor in India is stretched, and the clinic doesn't have time to give lifestyle change advice, and is just not able to, it's over, they're short-staffed, they're overcrowded, and there's just no time to give lifestyle advice. So we thought we could take that up as civil society, as a nonprofit, in the community setting. So that's what we deliver. Science-based prevention programs that are designed to bring about behavior change. So a lot of thought goes into the content, into the science, into the design. I really think we have very well designed the program.
Very nice.
So we follow what we now call a doorstep health approach. So we take prevention to people where they live, learn, and work. So we have programs for school children in schools, 11-year-olds, 12-year-olds, learning through games and activities, the basics of healthy living. And we have the workplace program that you were mentioning, where we have 250 companies that have been certified by us as healthy workplaces. And we have a text message program called M Diabetes that is really ready for scale in a major way. And in a country like India, with 1 point something billion cell phones in use, I really think, cell phones are a very powerful public health tool that we must exploit. We also use social media for education, especially with a program called My Thali that teaches women what to eat and in what quantities at every meal. Because most people are genuinely confused about what to eat.
So true.
And then we also have an Arogya City program where in Bangalore, for the first time, we experimented getting multiple stakeholders to commit voluntarily to improving the health of the citizens of Bangalore in tangible ways. And they have joined. And next week, it's actually in 3rd of December, we have a summit to celebrate their success and continue. And we're also talking to other cities to take this movement. So one city at a time, one community at a time, one individual at a time, we would like to make a difference.
It's very beautiful. And I think grassroots level impact is so critical. And one of the biggest challenges with, like the medical system itself and doctors, yes, they're very stretched. And also I think that kind of construct itself comes with a level of standardization, right? Where it actually needs to go beyond that to make it very personal. Each one's situation, each one's requirement is so different, right? So that's great to hear. A few minutes back, we were discussing that the numbers that we discussed initially, or I thought, in the space of diabetes, particularly in India, was around 77 million. But I was quite taken aback that it's way above that. So what's going on in the world? What's happening?
So diabetes is one of those diseases that people think they can just live with and it's not a big deal. But it is so alarming a crisis in a country like India, which already has so many public health challenges, right? You think about it, you have under 5 childhood mortality, you have anemia, you have women dying from pregnancy-related issues, you have so many infectious diseases. That's all still there. But those trends are going down, and the one that's going up is non-communicable diseases, including diabetes. So you mentioned the number 77 million. Yes, that was the number from a few years ago. But last year, a series of papers was published in the Lancet. And Dr. Anjana and Dr. Mohan's group looked at a serious study all over India, and they came up with the number 100 million diabetics in India, 136 million pre-diabetics. Both those numbers are scary because the pre-diabetics are going to get diabetes in very large numbers, very soon in 4 and 5 years. So it's a really serious problem. But this year on World Diabetes Day, another series of papers was published, or another set of papers in the Lancet, and they have shown India to be at 212 million diabetics.
Of actual cases, not even pre-diabetic cases.
Diabetics, 212. And India is now clearly number 1 in the world. The next is China at 148 million. And then you have the US at 42 million.
Wow.
And then Pakistan. So you think about it, it's this part of our world, South Asia and Southeast Asia. We are the diabetes capital of the world. India is now, whether we like it or not, number 1.
Number 1, is it? It's so scary.
It is scary.
It's so scary.
And what is alarming about something like diabetes is, you get diabetes at age 30 in a country like India, 10, 20 years earlier than people in the West. So Americans would get in their 50s, Europeans, 50s, Indians get it at age 30 and even earlier. So if you want to prevent diabetes, you've got to find people who are young.
Yeah.
Younger than age 30. So we go after working people who are average age 27, 25, and we go after middle school children. That's why our whole focus on prevention is at a younger population.
Yeah.
But this 30-year-old has additional significance. You think about it. They're getting diabetes. Indians are getting diabetes at the height of their productive years.
Yeah.
They have decades to live with their disease. And if they don't manage it, and India has the highest number, latest paper, of untreated diabetics as well.
Is it because of the social context that I don't want it? There's always this, it's okay, I'll eat sweets, it's okay, I'll do this. I don't want to get treated also. You have a lot of resistance.
So I think, one of them is the stigma. I don't want to be known as a diabetic, but it is actually also they don't know they have diabetes probably. And even if they do, they don't think of it as serious. They don't go see their doctor every 3 months, and they don't adhere to medicines and things. And they don't know that diabetes can lead to so many other serious complications. So diabetes is a serious disease, but what is worse is that it can progress to, heart disease and stroke and kidney disease and dialysis and nerve damage and foot amputations and eye disease. And it's the leading cause of preventable blindness. So if you think about all the things that could go wrong because of high blood sugar, uncontrolled high blood sugar in your body for a long time, you have a responsibility to take care of it. You have to, do everything you can to keep the sugar under control. Whether it means the lifestyle changes you must make, or it's the medicines you must take, or, whatever it is, there are tools available. Make use of them.
And we'll talk about that in detail as well. So, but Nalini, maybe you're not going to be surprised, but I will certainly not be surprised if most people don't know what diabetes is also. We've sort of normalized it to an extent that, there's somebody who I know who has diabetes in my family. Typically, we speak like that in India at least, right? But we don't know what it means. So can you help our audience understand what is diabetes?
So diabetes is a very serious disease where the blood sugar remains high in your body, and the body can't utilize the insulin very well. There are many reasons for why that happens, and there's no need to go into the biochemistry of this. But and there are two kinds of disease, at least two, type 1 and type 2. Type 1 is one where the body doesn't make the insulin and you get the disease very young as a child. The other is type 2, where it is supposedly lifestyle acquired, but children are getting type 2 diabetes as well now in India. And in fact, 10% of India's 5-year-olds, 5 to 19-year-olds are pre-diabetic.
Wow.
So, when you see numbers like that, pre-diabetes means 4 or 5 years, you're going to get diabetes, full-blown overt diabetes. So it is very, very alarming that type 2 diabetes is coming to so many young Indians. And there are probably a number of reasons why Indians get diabetes so young. It's probably genetically we are predisposed as people, and there is a lot of research going on. One theory is that our body doesn't make enough insulin, so the pancreas is smaller, and there are people doing that research. The other is the malnourished mother, young mother who is undernourished and has a low birth weight baby, gets married young, has a low birth weight baby, is probably going to set up that baby to get diabetes and heart disease at age 30. So if you can do something to have a normal birth weight baby, you can set your child up for life, for a better health, health in the future. So we can get that message across to women, hey, eat right, have a healthy pregnancy, have a normal birth weight baby. See your doctor, because you do need to set your baby up with everything you have to have the best chance in life. Why set them up to have diabetes 30 years later? So there's a lot of reasons why Indians get diabetes, because thin Indians at BMI 17 in rural India who work the
Yeah.
fields are having diabetes. So there are many complications and reasons why
You can't really pinpoint.
you can't
one
pinpoint.
thing. Yeah.
But overlay on that the lifestyles we lead today. Today you have busy mothers who are going home from the office,
Yeah.
who have no time to cook that wonderful Indian meal that we all love and crave, because the prep involved is so much
Yes.
that she just buys the food and
Yeah.
goes home,
Yeah.
and it's delivered. By the time she gets home, she has at least they can have a family dinner together.
Yeah.
So this eating out, convenience foods,
Yeah.
the lifestyles we lead, the stress, the long commutes, the lack of sleep, all these reasons are leading to a huge crisis.
It's affecting
of
more
diabetes.
people.
More
And I think that's the sort of downside of development, right? Your modernity, development, it eats up so much of your time that there are days now even I have not eaten
Yeah.
at work. But now that I'm doing something on my own, I'm actually at home a lot of times and I'm getting an opportunity to eat.
Yeah.
So I look better, I feel better. And something fundamentally has to change, right? With
Yeah.
the way things are all around us.
Yeah.
Yeah.
So if the trends of infectious disease are going down and the trends of diabetes and heart disease are going up,
So
and
scary.
hypertension, a third of Indians have hypertension. 3 out of 4 people, adults in cities,
Yeah.
in Chennai, in Bangalore, have diabetes or pre-diabetes. I mean, the phenomenon is so big that you really can't ignore it anymore.
Yeah.
It is going to be the reason why, if we don't address it, India, of course, won't meet the Sustainable Development Goals. The world won't meet it. But also, and this is something that, we have just realized in the last few
Yeah.
months of reflection. India is at this crossroads, right?
Yeah.
Incredible economic growth.
Yeah.
The whole world is watching India.
Yeah.
India's a promise. It's
Yeah.
wonderful to
Yeah.
see the
Yeah.
progress
Absolutely.
and the status of India on
Yeah.
the global landscape. But who is fueling that growth?
Yeah.
It is working people.
Yeah.
The working people are in their 20s and 30s by and large. And I am saying that that's the age at which
Yeah.
they're going to start getting diabetes in huge numbers, even much higher than what we have seen so far. So unless leaders of organizations, even startups, if they don't take care of the health
Yeah.
of their workforce
Yeah.
and get them checked up and screen early and get treatment quickly and, adopt healthier lifestyles, it's not going to happen.
Yeah.
The entire future of India
Yeah.
is going down. Demographic dividend is going to become a demographic disaster
Yeah.
unless we address it.
Yeah.
And really, it's the future of our country.
Yeah, that's very beautifully said. So can we say that diabetes is like the top 3 diseases in India?
I think it is. Yeah. It is one of the all the gains the world made against the Millennium Development Goals can be undermined unless we address diabetes and heart disease and
Sure. Yeah.
all the non-communicable diseases.
Yeah.
But it is something in India we can't afford to ignore.
And, through my reading, I understand that diabetes actually sort of disproportionately occurs in certain ethnic minorities, low-income groups, and certain countries like we discussed, right? Why does that typically end up happening?
Yeah. See, there is this, for ethnic differences, there are these genetic predispositions, right? Otherwise, you can't explain sometimes, why in the US, the Hispanics and the Black communities and the Indian Americans are the ones having diabetes and such, and Native Indians are the ones that are having so much diabetes. So there is definitely a ethnic difference. But if you look at the socioeconomic things, it's the poorest of the poor, even in a country like India, that are most affected by diabetes. At least the higher socioeconomic levels can be screened and treated and can seek treatment. Now, whether they adhere to the treatment or not is a different story, but there is access.
Yeah.
In the poorer sections, the access is not there. The awareness is not there. They really don't know that they have diabetes and they don't get treated. And therefore, there is, the impact is more. They lose their jobs. They cannot keep up with the healthcare costs because they have to usually borrow money from friends and family to pay for the doctor's visit. And then it ends up being a, catastrophic health incident like a heart attack or stroke, and they have to go to the hospital and incur further costs. So much better to prevent. And, I think the step one is awareness improvement, and then education, and then access to healthy food as well as, healthcare.
So can we say that, so a lot of questions are coming to my mind, right? One is to demystify. If I get diabetes, is it permanent?
Diabetes is manageable. Yeah. Definitely. But there is no cure.
There's no cure. So you better not get it.
Yeah. It's much smarter. Okay. Here's my pet thing. Okay. In a country as complex as India.
Yeah.
And with such huge numbers of diabetes, right? You cannot manage the government. No one entity can manage the crisis.
Yeah.
How can you treat your way out of diabetes? You just think about it. It's very hard. Yeah. And then from diabetes, you get heart disease. How can you give cholesterol medicine to everybody who needs it in the world? How can you give insulin to everyone who needs it in India? These are all really, really big problems. But you can prevent diabetes with 3 lifestyle changes. You must eat right, exercise, and avoid tobacco. These 3 changes, according to the World Health Organization, according to landmark clinical trials like the Diabetes Prevention Program, you don't need a new vaccine to tackle diabetes. You don't need a new technology. You simply have to lead a healthier life.
Yeah.
Individuals must do so. Communities must do so. States and countries must do.
Yeah.
If we all do our bit, yes, it is possible. So, Arogya World, we have chosen probably the holy grail of diabetes prevention, which is through behavior change, but also the hardest.
Yeah.
The hardest way. We all know what to do, but it's so difficult to get off that couch. Yeah. It is so difficult to eat right.
It's so true. And I was talking to somebody who's a friend of mine who's actually gained a lot of weight. So I asked her, so what happens? Why is it that, you give up fast? Her answer was so incredible because she said, you get used to it.
Yeah.
You get used to having the weight because you don't see results fast, but you're okay. You get comfortable with how you are. So any disease we talk about, Nalini, my understanding is there are only 2 or 3 things that you need to do. You just need to eat right. You need to move a lot. You need to cut off all the so-called toxins.
Yeah.
But it's so hard to do, right?
It is hard. And lifestyles are set at age 11, right? I mean, you would think about it, all the habits we have now were formed, when we were in middle school. So we are actually catching those middle school children. And so far we have reached about 2 million kids in government schools in different parts of India. And I'll just describe, because you mentioned obesity, I'll just describe that one activity, because I think our games, we did do this through games and activities, and they're beautifully designed.
Sure.
So the child reads about obesity in the classroom and then goes and runs a race from, a certain distance with a backpack full of books.
Okay.
And then at the other end, they take out that backpack and they run again. And they realize how much faster they can run and how hard it is to carry that extra weight on the body.
Yeah.
That life lesson, that child will never forget.
Yeah.
Or if they play a game of snakes and ladders and say an apple is a ladder and a bag of chips is a snake, again, it's a life lesson, that it's hard to forget. So we try to teach, in age appropriate, compelling ways, the basics of healthy living to children, because we really believe we can change the trajectory of this generation of kids. In fact, we made a Clinton Global Initiative commitment to educate 5 million kids on healthy living in the next few years. And we are working towards that.
Yeah.
And the only other thing I'll say is, as a small nonprofit, we are less than 25 people. We work with partners, we work with stakeholders, and we get very often others to do the work by persuasion. But the we have the biggest award we have got is a United Nations Interagency Task Force
Okay.
on NCDs and the WHO award for strengthening India's primary health care.
Yeah.
Through
Yeah.
prevention.
That's
So for us, that was in 2022, and
Yeah.
we're so excited about that award. Even in 2024, we're talking about.
Yeah, I know.
It's a very big deal, and so far we have reached about 19 million people through the end of this year on through our various programs.
Yeah.
But it's a drop in the bucket, India.
Given the
country,
crisis. Yeah.
But we are, making headway.
Yeah. So one of the things that I would like to understand better is if we look at lifestyle, right?
Mm-hmm.
And the choices that people are making today that is actually leading for them to end up with diabetes.
Mm-hmm.
What are 2 or 3 observations that you have in terms of what poor lifestyle actually is going?
Yeah. So one of the easiest to spot is physical activity. Indians today lead sedentary lives.
Yeah.
We get out of our homes and get into air-conditioned cars and get to air-conditioned offices and sit at our desks for 8-10 hours and work and come back in the same car home. So there's very little physical activity. And this leads to 2 things. One, of course, is diabetes, because 80% of type 2 diabetes is caused by 3 factors. You have to, or to avoid 80% of diabetes, you have to eat right, exercise, and avoid tobacco. So, the sedentary lifestyle is an important thing. But in the case of this office-going, air-conditioned car, person, 2 things: diabetes and hypertension. See, earlier people used to perspire in the fields, and it was okay. They got used to putting more salt on their food because that was important, because they were perspiring it all away. But now, because of this air-conditioned environment we sit in, we're not perspiring, and we're still used to that much salt, right? So Indians eat 5 times more salt than is prescribed. What's prescribed is 1 teaspoon of salt the whole day in all your meals. And we eat 25 grams. So 5 grams instead of that, we are eating 20. So we have so much education to do for Indians to reduce salt. We also don't eat right. In fact, 2/3 of the diabetes problem is because of our food habits. 2/3. And why is that? We eat carb with carb.
Yeah.
We eat puri with aloo.
Yeah.
We are so carb heavy in our meals that we need to change that.
Yeah.
We need to increase the amount of protein.
Yeah.
And yes, we are vegetarian. Yes, so many of us have other diet restrictions. And in a country as complex as India, with chapati and rice and fish and, vegetables and access and all those issues, in spite of that, we at Arogya World, we have created this My Thali tool that shows in a picture form exactly how much cooked food you must eat. So we used to have, guidelines that told us a woman must eat 9 times 30 grams of cereals and millets a day. And no one could understand what that was. Neither the housewife nor the nutritionist, could explain clearly how much food is that, how much rice. So now we have the cooked quantity. You eat 1 cup of rice, half a cup of rice, 1.5 chapati. And that's what we communicate in a picture form. And then we have this big Instagram, movement on My Thali and Healthy Wali, Diwali and other campaigns that get, people to think. Most important is to reflect on what am I eating,
Actually, that's a very interesting thing you're talking about today. The phenomena is that there's a lot of advice. A lot of people, I myself have watched a lot of videos, do this, but at the end of the video, you can't remember. I don't know why that happens. Is it the lack of visualization that actually creates a different connect or understanding? But that's the reality. You don't remember exactly what you're supposed to. And I think that's probably what's happening as well.
So the most important thing is eat right and exercise.
Exercise, eat right, and tobacco. So why tobacco? What happens?
So tobacco, makes your diabetes, if you're a smoker, the diabetes is worse.
Yeah.
And it leads to heart disease and lung cancer. So quitting tobacco is probably the single best health decision you can make in your life.
So many young people are smoking.
So many young people.
And it's rampant. I don't have any, everybody has a choice, but you see women, men, everyone in the city smoking.
And the women is scary. Yeah. No, it is scary.
Because our bodies are different, right?
Yeah.
To understand it from that lens as well. Yeah.
So, yeah, in the US, tobacco smoking has come down a lot. And it's exciting to see that.
Yeah.
It wasn't like that. And with so much effort on public health, campaigns, and you see the success in New York City, and you say, if we can do this in New York, why can't we do this in other places?
Yeah, absolutely.
It requires a lot of effort. So we are talking, for example, to companies to how to make them tobacco-free work sites.
Yeah.
And it would be nice to do that in so many places.
And it's very difficult to leave.
Very difficult.
Very difficult to leave.
It requires political will. It requires leadership engagement. And yet, a lot of hard work.
And it's not enough to just increase the prices of cigarettes. That is not a deterrent. People will readjust their budgets, right?
Yeah. And, but warnings are important. They have shown a lot, especially front of the pack labeling. Is a very powerful reminder of, every time you pick up something, if you're confronted by it. And then also, I really believe social media and mobile phone messaging is a very powerful way because you're confronting it. You've opted in and you've got the messages and you're reading it. And at least twice a week, you get some reminders. And so those are all useful.
Yeah, absolutely. And I agree. I cannot say anything else because when you see that picture, I do have a sense of fear.
Graphics,
But it's so overpowering that a lot of people are still struggling to leave tobacco.
No, it is.
Right?
It's
a completely different topic, and we have to get to that, right?
Yeah.
So, Nalini, tell me what about early diagnosis, right? How does that actually really help? The person who we can say probably has a poor lifestyle or even predisposed, right? So, why does it play such a big role in the space of diabetes?
Yeah. So, the importance of screening early cannot be, undermined. It is really important because people can go about their life, as if they had no disease if they don't know that they have the disease. So detecting early is very important. And the government of India, as you know, has really invested in screening for diabetes and hypertension in a major way all over India. And so why is that important? Because if you catch the disease early, there's a very good chance lifestyle can reverse it.
Yeah.
There's a lot of reversal programs now. And there's also that you can prevent the onset of complications. So let's say you adopt a healthier lifestyle because you have diabetes.
Yeah.
Then there's a very good chance you can control that sugar with everything at your means.
Yeah.
Because that's your responsibility. As a patient, you got the disease. So it is your responsibility. Dr. Mohan says from Chennai, it doesn't matter what you do, just maintain that sugar. That's your job. Keep it low. Because doesn't matter whether you do Ayurveda or you do, whatever you believe, your lifestyle, your medicines, your doctor visits. Yes, everything is important to keep the sugar in control. Because then you can prevent the complications. You can prevent heart disease. You can prevent stroke. You can prevent your foot getting amputated. You've seen so many cases.
So
kidney centers. Every time I see dialysis centers in India, and there are so many of them, I say, oh gosh, we didn't need these if we could control the diabetes.
So that's the core message, right? It can lead to so many other problems that you have. Just observe. And testing, right? So many of us don't go for medical tests. Annual medical checkups, I think, are very, very important.
Very important.
Right?
That annual checkup is so important, and it's the one preventive measure that you can take. Just show up at that prevention health checkup that your company probably is paying for, so that you can figure out what you are at high risk for today. You did one last year, you will do one next year, but it is good to get early warning. You can do something about it.
So, just so that we sort of graphically present it, right? if we have someone who has diabetes in our life, who's in our family, how do they live, which is different from the rest of us?
So they probably check their sugars.
Every day.
Yeah, it's important to check your sugars every day. And it is really the number one, just like putting shoelaces on your shoes to go for a walk prevents, if you have shoes that you can slip into, you would probably go for a walk faster.
Yeah.
That tying of the shoelace is such a burden that people will not walk. Just like that, testing of the sugar, because it requires a finger prick and it requires the 2-3 minutes of time, is really a deterrent.
So every day someone has to check their sugar, which requires you to
put a finger prick and take a drop of blood and check the sugar. That's the normal way through the monitor.
And that's there in India as well, is that?
Yeah. That's the most common way.
Why? And is that an insulin shot you take in many cases?
No. Insulin is something that is prescribed after some time. So the first thing the doctors will try is oral medicines. And there are many classes of it, but metformin is the very first one. And then there are many other things they will try. If it's uncontrolled with that and with lifestyle, because they will advise lifestyle. But if it doesn't work with just that, then they will add on injectables. And among the injectables, there are again a couple classes, but they will try insulin.
Yeah.
And insulin, if you are on insulin, you probably have to check your sugar multiple times a day, because you have to check it, just to make sure you're not eating more than what your insulin dose can manage or control or be accountable for. So you have to, if you're a responsible, compliant patient, checking your blood sugar many times a day is probably your life. And otherwise, you can lead a full life. As long as you're checking your sugar and you're managing your medicines and your food, then you can have a normal life. Everything you can do. You can walk, you can...
everything else is
functioning fine. You have to keep track.
What should they not eat?
So high sugar fruits that are very high in sugar, for example, chiku, grapes, bananas, very high in sugar.
Yeah.
Don't eat a whole banana, eat a half banana. Yeah. Don't drink fruit juice. Eat that one orange or half an orange.
Yeah.
And it's just, you have to just be conscious of it, and then you can handle it. But sweet in India, it's cultural, right? I mean, it's part of life. You celebrate with sweets. You eat. You give your children chocolate. You in the office, you bring a box of sweets to celebrate a promotion or the birth of a child or anything.
Yeah.
And this festivals, there's so many festivals that you make a sweet at home and you eat that. So it's the sweets, I think. If we cut sweets and you can watch the very sweet fruits, those are easy changes.
Great, yeah.
But the most fundamental change is to reduce carb and increase protein. And if we can do that in a conscious way, increasing protein for vegetarians is a little difficult, but you have to have more dal, more millets, more whole grains, and reduce white bread and reduce...
and balance it.
And balance. That's the number one method. The message is you must balance your meal. And that means eating all the 5 food groups, eating, the prescribed amount. And you can follow my tally. We like to keep people, healthy people healthy. How much rice, how much dal, and some fresh fruits, some vegetables, some cooked vegetables, the yogurt, that constitutes a full meal. If that rice is not white rice, but is brown rice, fantastic. If that chapati is made with whole wheat instead of, white flour mixed atta, that's great. So if you can watch that and watch also the amount of fat, but that's okay. I don't think nowadays modern Indians, we are all very aware and don't eat a lot of oil. So if you don't eat out, actually that's the number one.
Don't eat outside.
Don't eat out. Because eating out has been correlated with more disease, more diabetes.
So where we are sitting, we have at least 500 restaurants. We can walk up.
Yes.
And it's so fascinating because food from every part of the world is just 2 minutes away.
Yes.
And another problem is when we have a culture of food delivery here.
Yeah,
right?
yeah.
Just any time.
Yeah.
And this whole thing that I had never known, Nalini, that apparently a lot of Indians eat after dinner.
Oh.
So they have a Netflix culture. So you're sitting and feeling like you're junking, and then you have all these apps that
Bring it in 10 minutes.
and they bring it in steaming hot food in plastic box.
Yeah.
So it's a very vicious cycle that's leading from one problem to the other.
Yeah.
Right?
So I just want to, so eating a home cooked meal is the best thing you can do.
Yeah.
But in a country like India, where the street food vendors, we all go to, the dosa place and the chutney, the samosa place. So there's a lot of street food that is great in India and is very difficult for us. So we started at Arogya World, we started a education campaign for street food vendors, and we've educated 500 street food vendors in Bangalore to do two things: to reduce the salt in their chutneys and to not reuse oil for frying. So those messages are important not just for street food vendors, but for all of us. Not reusing oil and not. And
that's
trying
a beautiful initiative just to go to the source itself.
Yes.
Right? Yeah, that's
so if our mission is to change the way India eats, so if we have to do that, we have to go to the street food vendors, we have to go to restaurant owners, we have to go to individual communities and homes and people. So that's what we're doing.
That's great. I've loved this conversation.
Yeah.
I just have a few more things that I want to learn from you. What happens to, people who are around the diabetic person, right? What should they be thinking about, be conscious about? I don't know whether for diabetic people we can call them a caregiver, but yes, a caregiver.
Family member, yes. Sometimes there are caregivers, like the son is taking care of the father and, so on. So what happens, if everybody eats the way a diabetes patient is supposed to eat, then the world will be a very healthy place. The diabetic diet is a very healthy diet because you're supposed to have more protein, less carb. You're counting how much you eat of carb and sugary foods and sugary things, and you're trying to do nuts and increase the protein value of every small meal you eat or the snack you eat. And all of that, if we just follow what a diabetes patient, so if there is a diabetes patient in your home, then everybody in the home should try to eat like that, because that is a very good way to live. And so caregivers benefit in great ways. For the elderly patient, you have to take them to the doctor. Don't miss the doctor visit because that check blood levels is very important to make sure everything is okay. Doctor will do, also test the feet and the nerve reaction. So it's really important to keep all that going. But more than anything, you will automatically reduce eating out, which is a very good thing for the family. And if you can all increase the amount of protein and have a balanced meal, it's good.
But are there other symptoms other than getting a test to know that I am diabetic?
Yes, there is a rapid weight loss and increase in thirst. So if somebody is very thirsty and is going to the bathroom a lot in your family, the chances are very high in India that they probably have diabetes.
In India?
Yeah, because in India, diabetes is so common, right? That's why it's important that you get checked. But the other one is a waist size. Waist circumference in Indians is a predictor of diabetes. Very different from all the other measurements in the world. And this is something you can, keep track of. Just measure your waist because it's always...
It fluctuates a lot, as in if it reduces a lot?
No, increased waist size. And there are prescriptions for what's a woman's waist. I don't remember now what a woman's waist should be and a man's waist should be. And you will see that abdominal obesity is a very common thing in India, right? So that's because they're probably all diabetic or pre-diabetic, and the abdominal size is higher, waist size is higher.
Wow.
So we have to measure waist size and then go for that annual checkup, especially if you have a diabetic in the family.
Yeah. No, my God. I had no idea things like this happen, but it's very important. Giving a number, it's too alarming. So I think the conversation is super, super important. But when you look at the number, right, in conclusion, Nalini, what do you think the future of health will be in the world, right, if you think about that?
So, for me, if the world can't meet the sustainable development goals with me living in it, then I haven't done my job. I must, as an individual, do my very best to help the world reach, because we have, as a world, set goals. And if we, it's possible they won't meet it because of the diabetes problem in India. So we have actually an opportunity to change the trajectory of diabetes in India, improve the economic landscape of India and the workforce health, and also really meet the world's goals. In addition, if we can just tackle diabetes, we can probably reduce heart disease and stroke and kidney disease and all these other things, and blindness. And that's another great, outcome from this. So diabetes is a very fundamental disease, and it affects Indians in alarming ways, and we can do something about it. And I just want to talk about what the government could do. We spent so much time on what the individuals and communities can do, which is all wonderful. But the government is doing a lot on screening, which is great. But just screening is not enough. You need to make sure that the person who is a newly diagnosed hypertensive or a diabetes patient is referred to the primary health center and followed up for treatment, because that closing of the loop doesn't always happen. There are major initiatives to detect, but I think we have equal responsibility to make sure that they are followed up in the health system. One of the other things is, there are NGOs like Arogya World that is doing, its best to reach large numbers of people. And the government system gives us a wonderful way of interacting with the consumers. So if the government partners with NGOs and public health organizations, even if they are not, and the private sector, to reach the consumer and rural consumer at the end, it would be so great. So they're already collecting, for example, phone numbers of these villagers, or even in urban settings, so that they can follow up with them next year for the annual screening, right? That the government is already doing that. So since the phone numbers are collected, piggybacking on that whole system with a text message program like ours is so smart, that I would love to see that happen. A little bit more partnership with nonprofits, so that it helps.
The scale is
just so big.
And primarily, if my understanding is right, Nalini, it's so much to do with prevention. So the more partners you have, it might just be better. Right?
Absolutely. So the government is screening, but can do a little bit more on prevention, because that will help a lot. The other appeal is to, other nonprofits. So we are in the health space at Arogya World, but there are others that do education, and there are others that do livelihoods, and there are others whose job it is or mandate it is to, transform communities. All of these we can partner with. So the appeal is, if you're an education NGO and you're working with school children, please talk to us, because we can add our health program, which is already proven to work. Stanford Care has actually done a third-party evaluation of the results, and we're getting very good results in that. So we are very eager to partner with education NGOs, because we don't have access to the schools and the school systems. It would be really good to, partner with them. Same thing with the other communities as well. If you're working with fisher folk, please talk to us, because our messages may be just the correct thing for it. This requires a multi-stakeholder collaboration. Truly, the World Health Organization, Margaret Chan used to say that we need to work together, multi-stakeholder, whole of society. That's what they call it. whole of society approach, which is true. We need government to partner with civil society, with education NGOs, with private sector, because we can't afford, right? I mean, I can't afford to sit back. This is something that
I'm just shocked with the numbers. It's too huge, and it's being a number of things are being normalized. That okay, we can live with it, we'll figure it out. But this is very alarming, and with India having so much of like future ahead of us, younger population, if your younger population is sick faster, it's a disaster.
It is a disaster.
So I've had a very beautiful conversation, loaded with so much of knowledge and information. Thank you so much for sharing, Nalini.
Thank you, Mohana. Thank you. I hope we can use this, video or podcast to do something good with, move somebody's heart and somebody's mind.
It will. So thank you so much for your messages, and it was lovely talking.
Good to talk.